Welcome everyone, and thank you for listening to this presentation on value for money in Grant Cycle 7. It's a topic of utmost importance to invest limited resources as efficiently as possible. This presentation is for informational purposes for Global Fund and country partners, technical partners, and secretariat staff at the Global Fund. For those of you who don't yet know me, my name is Marijke Wijnroks, and I'm the head of the Strategic Investment and Impact Division at the Global Fund. I have served on the Global Fund board, but also worked as a field doctor in South Sudan and Uganda, witnessing firsthand all the work done in countries to fight the three diseases and strengthen systems for health. To continue to have an impact on the communities we serve, we need to continue to maximize the impact of investments. And with limited resources, this is now even more important than ever. The concept of value for money is not new to the Global Fund. In fact, value for money has been a key principle guiding Global Fund investment decisions throughout the years. Value for money is an integral part of the Global Fund Strategy 2023-28 and continues to be a key component of the criteria that the Technical Review Panel uses to review fund requests. The value for money framework has evolved to adapt to countries' needs and epidemiological changes. In this presentation, you will listen to an explanation of the current value for money framework and how value for money can be approached throughout the Global Fund grant cycle, and particularly during the applying for funding stage. Value for money is critical to ensure that Global Fund investments are sustainable and can maximize their impact to support countries reach global goals and grant targets. Together, we can design and implement grants that embody value for money concepts to end AIDS, tuberculosis, and malaria, while strengthening systems for health and prepare for future pandemics. I take this opportunity to thank you for your attention during this presentation and for your continued collaboration in the countries you serve.
Technical brief value for money. Thank you, Marijke, for your introduction. Today we will discuss what value for money means in the context of the Global Fund and how it can be used for Grant Cycle 7, or GC7. We recommend that applicants watch this presentation before submitting their funding requests to the Global Fund. The goal is for applicants to build value for money into a grant from the start. In this presentation, we will cover the basics of value for money. We will not go into all the details here, in the interest of keeping this presentation to a reasonable length. These slides, as well as a more detailed presentation and the value for money technical note, are all available on the Global Fund website under Applicant Guidance Materials. In today's environment, it is imperative, as Marijke noted, that Global Fund investments are used as efficiently as possible to fight AIDS, tuberculosis, and malaria. What is value for money? Value for money is the effort to make the most efficient use of limited resources. Value for money has long been a guiding principle of the Global Fund. But today, every country faces significant financial challenges as a result of the COVID-19 pandemic and the current geopolitical situation. This makes value for money become even more important. Value for money must be built directly into the design as well as the delivery of programs and services. It begins with the funding request. Today's presentation will focus on what implementers and decision-makers need to take into consideration during their consultative processes and while creating the funding request that they will submit to the Global Fund. However, value for money does not end with the funding request. These principles and tools should be utilized throughout the grant lifecycle. The 5 dimensions of value for money. Value for money is best understood as being composed of 5 dimensions. Value for money aims to maximize equitable health outputs, health outcomes, and program impact for a given level of resources, and sustain these results. The best way to build value for money into the program is to begin with the intended impact and work backwards to the selection of inputs. The Global Fund's value for money framework includes effectiveness, efficiency, economy, equity, and sustainability along the health production chain. What does this mean? Effectiveness means to invest in the most impactful interventions at an appropriate scale to generate the intended results, while strengthening health and community systems and addressing structural barriers to HIV, TB, and malaria preventive interventions and treatments. Efficiency means to optimally allocate and utilize resources through successful and robust grant management processes. Economy means using robust procurement systems and resources to purchase the appropriate type of inputs at the lowest sustainable price, and optimizing program management costs. Equity means to eliminate unnecessary, avoidable, unfair, and unjust differences in health between individuals and groups. Sustainability means to enable a health system to maintain and scale up coverage to a level that provides for the continued control of a public health problem, even after global fund support comes to an end. All 5 dimensions must be considered in their totality, they cannot be assessed independently or in isolation. The key is to find the appropriate balance between these 5 dimensions, which may not always advance in the same direction, taking into account country context, epidemiological trends, programmatic gaps, expected results, contributions from other funding sources, available budget, and health system capacity constraints. Establishing the appropriate balance between these 5 dimensions is best done through an inclusive decision-making process that assesses the feasibility of value for money, given health gaps, needs, and opportunities, one that is technically focused and evidence-based. Next, let's review each of the 5 dimensions of value for money in detail. The first dimension of value for money is effectiveness. The effectiveness of a grant can be measured through 3 key elements: reduction in the burden of disease, removal of structural barriers, and strength of health and community systems. You can see in this slide the 3 components of effectiveness, with the questions that decision makers need to ask themselves. In terms of burden of disease, there are several points to keep in mind, such as setting ambitious targets that are aligned to the National Strategic Plan for the diseases, defining a clear rationale to explain prioritization decisions and trade-offs, and developing a detailed gap analysis with disaggregated data as the basis for the selection of interventions. For structural barriers, applicants should ensure that barriers and their root causes have been clearly identified. Interventions to address these barriers are integrated into the disease programs, and results are being monitored to see if barriers are effectively being removed. Regarding the strength of health and community systems, key questions include: is there a robust analysis of system bottlenecks across the disease programs? Are health services supported by strong community systems? And are the suggested interventions designed to go beyond merely supporting health systems to actually strengthening them? Some suggestions for achieving effectiveness could include, for example, updating national guidelines to meet the latest evidence and recommendations, integrating human rights interventions into programs for key and vulnerable populations, on-the-job capacity building to strengthen the quality of services provided at point of care. There are a number of technical guidelines available to assist programs in enhancing their effectiveness, such as technical briefs on key topics, information notes on HIV, TB, malaria, and resilient and sustainable systems for health, and the Modular Framework Handbook. All of these resources are available on the Global Fund website. The second dimension of value for money is efficiency. This can be grouped into 3 kinds of efficiencies: allocative efficiency, technical efficiency, and grant management efficiency. Allocative efficiency can be summed up as the right intervention mix at the right place for the right people. It is based on the prioritization of interventions, taking into consideration the following: programmatic and financial gap analysis, including population-level coverage gaps, Disease transmission and intervention impact modeling. Stratification exercises. Subnational context differences. And the evidence and rationale behind budget allocation decisions. There are a number of tools, both disease-specific and broader health sector allocative efficiency tools, that can support decision makers in their strategic resource allocation. One country who successfully applied allocative efficiency is Zimbabwe. The Zimbabwe National Malaria Control Program conducted a malaria impact modeling exercise to project the number of malaria cases, as well as the level of resources required, depending on different vector control combination options, and defined which option is likely to achieve the lowest cost per case averted. Technical efficiency can be achieved by ensuring that service delivery modalities achieve great outputs and outcomes. Investing in health systems in an integrated manner to avoid duplication. And optimizing the mix of inputs used to deliver on a specific intervention. Technical efficiency improvement can be informed by costing analysis, for example, through analyzing routine expenditures to understand cost drivers and to identify opportunities for efficiency gains. Adjustments in community-based service models in Uganda, Lesotho, and Malawi illustrate how technical efficiency can be implemented. To analyze the cost of ARD service delivery, these countries have aligned patient prescription refills to either a 3-month or 6-month periods and facilitated drug distribution at the community level. This shift enabled the countries to significantly reduce the cost per patient, increase retention of patients on treatment, and achieve greater viral load suppression. Technical efficiency can be gained through efficient procurement of health products. Good procurement practices will include aligning quantities with the country's capacity to deliver, ensuring data accuracy and reliability, conducting periodic reconciliations, planning for treatment regimen transition, and mitigating the risks of overstock or stockouts. The third type of efficiency is grant management efficiency. This form of efficiency focuses on ensuring that implementation arrangements are streamlined, that all the implementation options have been explored, and that the options chosen are informed by the financial mapping of services. Grant management efficiency will look at financial absorption, program management costs, and the performance of principal recipients and subrecipients. In South Africa, for example, a civil society PR was able to enhance grant management efficiencies by implementing a customized management system that gave them greater visibility on service unit costs. The new system allowed them to monitor absorption, analyze expenditures, keep an eye on program performance, monitor health worker performance, and track stock. This allowed them to track how funds were allocated and spent, and link those funds directly to results. To enhance efficiency, countries can consult the Health Financing Systems section of the Modular Framework Handbook and plan needed investment accordingly. The third dimension, economy, can be broken down into 3 elements. The first sub-element is to ensure right price for the right input. Applicants are encouraged to conduct a thorough review of service costs and identify the grant cost drivers. This sub-element can be improved by using pooled procurement mechanisms to procure health and non-health products and equipment from domestic resources, compensating human resources for health fairly, in line with national human resources procedures and salary scales, and leveraging online solutions or decentralizing resources to reduce travel costs related to oversight and supervision. The second sub-element of economy is to ensure optimal program management costs. Program management costs are expenses that do not directly contribute to service delivery but are important for successful program implementation, including human resources, travel-related costs, external services, non-health equipment, and indirect and overhead costs. High program management costs have been flagged by the Technical Review Panel, TRP, as a key risk for value for money. The TRP encourages applicants to minimize spending on program management while strengthening the capacities of systems for health to deliver quality services. The third sub-element of economy is to ensure robust procurement and financial management systems. Robust procurement systems are imperative to ensure quality products and services are procured through transparent, competitive, impartial, and accountable procedures. Strong financial management systems are also key to supporting timely and accurate financial reporting, improving absorption of grant funds, enhancing the flow or control of funds, and mitigating fiduciary risks. Without robust procurement and financial management systems, the other two elements of economy are hard to achieve. Equity is the fourth dimension of value for money, and cuts across all aspects of healthcare programs. By embedding the Global Fund strategy in funding request development and grant design, countries can be positioned to address inequalities in health service availability, utilization, and outcomes. The first sub-element of equity is to ensure resources are spent fairly. That is, to allocate a fair share of resources to marginalized groups. It is important to remember that marginalized groups may need more resources than others in order to achieve the same health outcomes. For example, consider the following. Whether the funding request is based on robust analysis and disaggregated data. Whether interventions targeting the most marginalized populations are planned using a population-based approach. Whether all specific activities and potential incremental costs are accounted for. And whether adequate resources are allocated. A practical example might be to provide more accessible services for those living in rural poverty. In terms of leaving no one behind, considerations include whether interventions are designed based on an analysis of the underlying causes of health inequities. Whether the interventions to address the underlying causes are appropriately resourced, based on evidence and best practices. Whether they will contribute to high service coverage. And whether communities are involved in the design and decision-making processes. One example illustrates how user fees can be monitored and their impact on access to services assessed. For equitable health outcomes, questions to ask include whether activities to monitor and evaluate interventions are funded. If building capacity for data collection and analysis is included in places where disaggregated data is not available. And if processes are in place to facilitate continuous learning, to assess what is and is not working in the efforts to reduce inequities. The fifth and last dimensions of value for money is sustainability, which also cuts across the entire health production chain. The Global Fund's efforts on sustainability are focused on ensuring that health programs can maintain and scale up service coverage to a level, in line with epidemiological context, that will provide for continued management of a public health problem. This should continue even after Global Fund support comes to an end. Efforts to strengthen sustainability can come in many forms, including addressing health systems challenges, improving domestic resource mobilization, reducing dependency on the Global Fund for specific interventions critical to programmatic impact, and transforming health systems and national responses to be able to sustain impact without donor support. The Global Fund publishes comprehensive guidance on sustainability, available in the Sustainability, Transition, and Co-Financing Guidance Note. The Global Fund's sustainability, transition, and co-financing policy represents the organization's commitment to partner with countries to more proactively strengthen sustainability, improve domestic financing, and prepare for transition. Key elements of the sustainability dimension include ensuring sustainable program and system-level investment. This includes considerations related to ensuring that funding is allocated based on health sector plans and not limited to disease program prioritization. Additional considerations include ensuring affordable and programmatically feasible service delivery for national governments to take over in the future. Where possible, countries should also consider strengthening national systems, instead of supporting parallel systems. And ensuring that the introduction of new technical is informed by strong epidemiological and financial justification. Considering both near and long-term programmatic goals, especially in circumstances where such introduction will incur higher upfront costs or have long-term financial implications. Promoting meaningful domestic resource mobilization. This includes ensuring that co-financing commitments focus on critical programmatic gaps in HIV, TB and malaria, and/or RSSH, with defined timelines for reporting, clear sources of data, and clear supporting evidence to monitor their fulfillment. Preparing for successful transitions. This includes strengthening country-owned transition planning, focusing on the sustainability of interventions for key and vulnerable populations. Integrating Global Fund-supported services into national health systems, ensuring strong co-financing of services financed by the Global Fund. More detailed guidance on sustainability is available in the Sustainability, Transition, and Co-financing Guidance Note, and more examples are included in the full Value for Money technical brief. This next section details how the Value for Money framework can be applied through the grant lifecycle. Applicants are encouraged to enhance value for money throughout the grant lifecycle, from funding request to grant closure. Before applying for funding, value for money should be considered far in advance of the receipt of the Global Fund allocation letter, including during the process of development of the National Strategic Plan. When applying for funding, greater focus is expected at different steps of the review process, given that value for money has been embedded in the application materials for the 2023 to 2025 allocation period. During grant making, this is a critical stage when budgets are elaborated, targets are disaggregated, and implementation arrangements are confirmed. At the same time, service delivery modalities and approaches to implement the approved interventions are clarified. All these steps are essential to achieving efficiency gains or strengthening equity and sustainability. Grant making also gives an opportunity to identify, across disease components, areas of shared investments and co-prioritization that could lead to great system-level integration. This stage of the grant lifecycle also provides implementers with a chance to identify programmatic and operational risks that may limit value for money in grant implementation. During grant implementation is when value for money will really deliver on the expected output, outcome, and impact. Monitoring is key, so that countries can really see how value for money is impacting their outcomes. Achieving value for money requires addressing the 5 dimensions in a balanced way. There will be trade-offs, and countries must consider the country context, epidemiological trends, programmatic gaps, expected results, contributions from other funding sources, available budget, as well as health system capacity constraints, when striking balances across the 5 dimensions of value for money. It is also important to understand what value for money does not mean. Paying the lowest price for products or services, without considering its quality and impact. Reaching the largest number of people served, without considering equitable access to services. Prioritizing short-term wins, without considering the sustainability of the program. Performing well in a single or sub-value for money dimensions. Some tips to approach value for money include: consider how value for money applies across the health results chain. Not all dimensions may be relevant at the same moment in time. When trade-offs need to be made, ensure an inclusive, data-driven and transparent process that is well documented, including the effective engagement of civil society and affected communities in the decision-making process. Align with national strategies, consider long-term implications. Consider value for money across planning and implementation, in other words, from strategy planning and policy development to operationalization, program implementation, and M&E. View value for money as a continuous process for improvement. Plan to generate evidence and build capacity in data utilization to support value for money dialogues purposefully. One typical trade-off is between equity and efficiency. These two dimensions may at times seem to conflict, but their goals are, or can be aligned, in most settings. Improving equity helps to achieve efficiency, and vice versa. Another typical trade-off is between economy, efficiency, and effectiveness. In sum, economy, efficiency, and effectiveness should not be viewed independently. Value for money is not about paying the lowest possible price for products or services, being economy, at the expense of quality or impact, being effectiveness. Decision-making that may lead to near-term inefficiency can still be considered for its long-term economy. Poor economy in the short run needs to be well balanced with the longer-term effectiveness. It is also very important to consider trade-offs between efficiency, effectiveness, and sustainability. For example, keeping girls in school or avoiding early pregnancies is likely to generate positive outcomes in the mid and longer term and should not be deprioritized in favor of interventions showing quicker impact. Challenging operating environments, COEs, include a wide range of countries, from chronically unstable countries to emergencies with fragile and rapidly changing contexts. Value for money planning should take into account country context. For COE countries, this means effectiveness and equity dimensions are the core elements and constitute the greatest focus. Differentiated implementation modalities should be put in place, aiming to leave no one behind by ensuring equitable access to quality health services. Efficiency dimension, allocative efficiency remains important, but limited data quality may prevent countries from conducting such analysis. Given that implementing quality programs in COE countries may necessitate more costly and comprehensive service delivery modalities that may increase service unit costs, the importance given to technical efficiency may be lessened. However, flexibilities aim to strengthen efficiency in program management and implementation. Economy dimension will need to be considered against increased flexibilities and differentiated implementation arrangements, as the cost of doing business in such contexts can be higher. Applicants will need to balance how higher unit prices can improve access to quality services. Sustainability dimension remains an objective, with the vision to move from emergency to RSSH and sustainability. Refer to RSSH information note for more information. Applicants should consider an appropriate mix of humanitarian and systems strengthening approaches that focus on building resilience. Value for money is one of the key criteria by which the TRP evaluates funding requests. Value for money, as mentioned, needs to be a fundamental consideration throughout the grant lifecycle. There is not one value for money section in funding requests. Rather, each value for money dimension needs to be articulated throughout the application forms. The dimension of efficiency, although core to value for money, can easily be overlooked. Special focus should be paid to prioritization of both program and system interventions for greatest impact, optimal geographic distribution, strategic choice of platforms, modalities, and inputs for efficient service delivery, leveraging a people-centered integrated approach, and lean yet effective implementation arrangements. Applicants are encouraged to use value for money concept or principles for funding request preparation. Provide evidence to rationalize the asks, including that for resource allocation, program design, and utilization, program implementation. Articulate overall value for money efforts, including the balance of interventions across the 5 value for money dimensions, given their country setting. Plan corresponding effort or investment in the grant to address key value for money gaps, including generating evidence and building the capacity of countries to maximize efficiency and make broader value for money trade-offs, ensuring impact not just on global fund grants but on the health system and epidemiological situation as a whole. In summary, value for money provides us with a framework to ensure global fund investments are sustainable and can maximize our impact to fight the 3 diseases, strengthen health systems, and prepare for future pandemics. By integrating value for money into funding request development, grant design and implementation, we are better equipped to support countries reach global goals and grant targets efficiently and effectively. For more information, access the Global Fund website, Value for Money Resources for Applicants. Thank you for your attention.